Good morning, everyone. This is our next webinar session, and we'll be discussing on how to prepare for USMLE Step 3. So our today's presenter is Dr. Bushra Ghafoor. She will be presenting her experience and will be sharing her tips on USMLE Step 3 exam. Dr. Bushra is an international medical graduate from Pakistan and currently working as a clinical research assistant at UT Southwestern Hospital. Welcome, Dr. Bushra.
Thank you so much. Good morning, everyone. Thanks, Aspiring Mentors, for giving me a chance to share my experience with you guys. As Malkeet has already introduced me, that I'm Bushra Ghafoor, working as research assistant. And I have recently done my Step 3 exam almost a month ago. And let's share my experience. And first thing I want to tell you, it will be more as an interactive session. The more questions you will do, you will get more understanding, or whatever your confusions are, that can definitely help you. So as most of you may know or may not know, but first I want to tell you the pattern of Step 3 exam. It is of 2 papers, paper 1, paper 2, and in paper 1, it's mostly about basic sciences, basic questions, and in my exam, it was like 40% biostrat, 20% is like ethics questions, ethics, communication skills, as you have already experienced in CK exam as well, and communication questions. In ethics, it's not like simple ethic questions that we do in Step 1. The questions are more like how you will respond to such type of situation, how you will answer this physician, or you have experienced those questions in Step 2. And rest 30% is for journal questions, 30 to 40%. So main content will be biostrat for this. Your biostrat needs to be very strong. And what will be the pattern of paper 1? It is almost exactly 232 questions with 6 blocks and 38 to 39 items in it, 1 hour for each block. So you have total 7 hours and 45 minutes break, 15 minutes tutorial that you can add in your break time. And how you prepare for paper 1, definitely you have to practice your word. And as I told you, biostrat needs to be strong. You have to revise your biostrat review. That is, we did already in Step 1, and it is in new world of Step 3 as well. If your abstract questions and drug ad questions, they're weakened, you can watch Randy Neal videos, because in each and every block, you will see 2 biostrat and 2 drug ad questions, minimum 2 drug ad questions. That was in my paper. And then ethics. And I don't know how to prepare for ethics because these are communication questions. And then first aid. Why first aid? Because first aid for journal questions, you will see questions from receptors, journal pharma questions, alpha receptors, beta receptors, those types of things. And then there are immuno part, in which you will see transfusion issues and hypersensitivity disorders and hypersensitivity types. And in pharma, journal pharma of each section should be on your tips, because in paper 1, there are questions from pharma, mechanism of action of pharma, adverse event of, they will not tell you the drug, they will give you a whole long scenario. And in paper 1, questions are pretty long enough, more than UWSA 2. UWSA 2 questions are long, and paper 1 questions are exactly similar to it or lengthy than that. We prepared for that, for time management, and they give you a complete scenario. They will not give you a drug name, but then they will ask you what is the mechanism of action of the drug that you will use to treat this condition. Does it make sense?
Yes.
Sorry. So in a way, they're going to have you understand the scenario, and then they'll just, you know, treat the patient, and then whatever treatment is that, it would be the drug that you're kind of thinking about, and then that you got to know the mechanism of action of that drug, like
Exactly.
in that sense. Okay.
Either it can be mechanism of action, or it can be most common adverse event, or they can say that patient is resistant to this drug. So what will be the next drug you can give, and what can be its mechanism of questions? So questions can be of 2, 3, 4 steps. So paper 1 was tough for me, and most of the people as well, as I have seen on Reddit. Let's move to paper 2. In paper 2, it is a relief that questions are short and very short. Like some questions are of 3 lines, 4 lines, even mostly questions are like this. And easier to read, easier to understand. You will not get lost while reading questions. And paper 2 is of 9 hours, 180 total questions, 6 blocks, 30 questions in each block, and 45 minutes are for each block. That are pretty much enough, because after doing a block, you are left with time. You have time to add it in your break, because questions are short. And definitely you have to do your word. Risk factors, there are a lot of questions on risk factors in paper 2. What is the most common risk factor of breast cancer, most common risk factor of endometrial cancers, most common risk factors of this diseases. So make sure wherever you see risk factor, you need to know and cram it. Vaccination schedules, I revised it for paper 1 as well, because I did not know where I will see these questions, but my paper 1 does not have questions on vaccinations and screenings. These questions are on paper 2. And then CCS cases, most of you may be familiar with the CCS cases, but some may be new. If you are new at it, then you can see CCS cases are of 2 types. It is a long case that is of 20 minutes and a short case that is of 10 minutes. And total, you will see 13 cases. And then how you will prepare for it, CCS cases, you can do your word CCS cases, you can do ccscases.com, and then there is a PDF book named Crush USMLE Step 3. Why that book is important? Because sometimes you see, for example, a drowning, I'm giving an example, the drowning case, and you are unable to grab how you will manage it. Each and every case is there in this book. So you will open this book and you can quickly read the points. Okay, if the case is about drowning, how I can do it. And then there is a list of arranged cases, as I have mentioned here, that you can find on Skype, on which they have written that this case number is this on UWord, and this on in Crush USMLE, and this is the number on ccscases.com website. So if you are trying to, because when you do ccscases.com, they have written a percentage that this case is 90% important, this case is 80% important, and this case is 20% important. So you can, when you are close to exam, you will prioritize it according to the importance. I did like that, and so that you will not miss any important topic or a case before going to exam. Because CCS cases carries a lot of weight in paper 2 as biostat in paper 1. So because I messed up paper 1, I feel like I messed up, but then I practiced and focused more on CCS cases. And do you have any questions till now?
We have a few questions on the chat section, but we can get back to them after you're done with your presentation.
See,
yeah.
How much
So I
time?
have a question. So
How many?
except from the UWorld, ccscases.com and the Crush USMLE Step 3, do we need to use some other resources apart from them?
ccscases.com, are you using it?
No, I have not studied the preparation yet. So I'm just having the overview of everything.
So you need to use that. I mainly did CCS cases from ccscases.com website. There are 150 cases on it, and you do it once. When your one round is complete, then when you are close to exam, you prioritize your, either you can do your bad cases that you have performed poor, or you can arrange it by percentage and focused on important CCS cases.
So how to start the prep? Like start with the UWorld directly or just have a
I can
plan?
tell you my story, and then I can answer this question. That's
Okay.
why I first prefer what you can expect in your exam. Then you can think about how to prepare for it.
Thank
How
you.
much time did you take to prepare for step 3? I will also share this thing. And how many CCS cases per block and how many blocks for these cases. 13 cases are there total and 13 blocks are there. And this is the same thing, that 40 total 45 minutes break is there that you have to manage in doing blocks as well in CCS cases. But there is a pattern to do the CCS cases. And the pattern is you have to do it slow. I will tell you that thing as well, why you have to do it slow. You have to do it slow. If you do it quickly, when we practice CCS cases, in ccscases.com website, there is a difference in the website and the website you see in the real exam. The real exam website is exactly similar to NBME orientation website, on which they have given you 6 CCS cases. Make sure to practice that website 2 to 3 times before going to the exam center. Because why I am focusing on this thing, because people told me that website will be exactly similar to ccscases.com in real exam, but it was not like that. That was different. And this is the thing that I noticed one day before my exam when I was practicing NBME orientation website. Over there, if you are messing up a case, patient will go home and patient will not come back to your office. Doesn't matter how many times you will call him to come back, patient will not come back in the real exam. So you need to practice 2 to 3 times from that website, and then you can know how the website will work in the real exam. And why I'm saying that you have to do it slow, you have to do it like you are treating a real patient. For example, if a patient 4 years old with a fever and irritable came to your office, how you will treat it? You will start doing simple tests, CBC, urine analysis, urine culture, or whatever you want to do. You will order it, then you say, see you in 20 minutes or 30 minutes. Keep it slow. If you write all the tests at one time and you say, see you next visit, patient will go home and case will end. This happened to me in the real exam. That's why I'm telling you, do it very slow. While practicing, you will feel like time is ending. But in real exam, when I was done with CCS cases, I still had 20 to 25 minutes break at that time. Because each case break time will add on into whenever you end the case earlier, the case will automatically end. Mostly cases end. It will end and time will be added into your break time. I will talk about CCS cases in detail again, but
These cases are the part of first exam or the second exam?
second exam.
So what was your timeline between first exam and second exam? How many days did you prepare for the second exam? And what was your gap?
For paper one, for me, the area I live in, Dallas, if anyone is living in Dallas, dates are not easily available. I booked my exam in, my exam was in June. So I booked it in April, I think April or March, and I was unable to find any date in my own city. I booked it in any other city, and then I kept on looking if I can be able to find the date. And the date I found was 1st and 8th. There was a gap of 7 days, and people told me that the gap should be of 3 days or 4 days, but it does not matter. Why it does not matter? I feel like when I was done with paper one, I was worried. I was panicked. I was freaked out that I have messed up my paper one. Then I took a break of 2 days, to be honest, 2 to 3 days. And then I got anxious about paper two. And then because I had time, so in next 3-4 days, I started preparing well for paper two. And one of my friend also have paper one, and she has a gap of 4 days. And exactly after paper one, she was worried about paper one as well and paper two as well. So it all depends on your own, how many days you want in between. People do it. It all depends on how much time to have. If you don't have time, you can take 2 days or 1 day. And if you have time and you want to keep it smooth and relaxed, then you can take a week. It does not matter.
Thank you.
Especially if you are weak in CCS cases. I have seen a person who has a gap of 10 days to practice and strengthen CCS cases. Because for paper two, you have to focus a lot on CCS cases. And how I prepared for step 3, my story is I did it in 4 months. People can do it in 1 month, and people do it in 6 months as well. Why there is a difference? Number one, it all depends on your previous knowledge as well, how fresh you have taken step 2, and what is the grip on your clinical knowledge, and how consistently and how seriously you are studying from day 1 till your exam day. Because when I started, I was very relaxed and I was trying to do questions, but I was not focusing on the depth of questions. I was doing it in very relaxed mode. And after 2 months, I realized that I'm not doing it well. Then in next 2 months, I devoted much time, I will say minimum 5 hours. And in last month, I devoted 8 hours or 9 hours to improve my scores and perform better for next assessment, UWSA 2, and in my exam. So if you are very serious and you are trying to do it in a month or 2, definitely you can do it. But then you have to devote your time as you do for step 1 and step 2. Then you cannot stay relaxed, and you have to start doing 40 questions a day from right now till your exam day. Definitely till exam day, you will increase it to 80 questions or 3 blocks. Because in, I will say in April, I'm not sure about the month, but in the second, when I did dedicated period for 2 months, in first month, I did U-word all again with a study partner. I did minimum 50 to 60 questions with her. When I came back from my job, I did not sleep. And I have to sit with my study partner and do 50 to 60 questions a day, because I need to cram the things at that time. And in the last month, I studied alone. How I did it? I did because my biostat was weak. And I will highly recommend start doing and focusing biostat earlier. Don't wait that you will do it till end. You will do it in last 10 days or 20 days. Then you have to do a lot of stuff. You have to practice biostrat, you have to do first aid, you are worried about U-word, you are doing assessments, and you need to review it. So your biostrat needs to be strong, at least start doing it from the start of your last month. 30 days, I will say. I did it like I do 20 questions of biostrat daily in my last month. Why I'm saying 20 questions? Because my biostrat was weak. And along with that, I was doing 2 blocks of U-word daily to practice my, to train my mind. So it will be almost 100 questions. And then after that, I review my biostrat questions first. I try to grab the concepts, learn what they're saying, and link with the scenarios. For example, lead time bias, length time bias, you need to know how to apply this concept. There is no chance that you can mess up this question, because in real exam, it's not like a simple 4 or 5 lines questions. They will give you a lot of numbers and you need to know what they are talking about. For biases, they will not ask about simple questions. There are tables and numbers on it on most of the questions, and you will get confused. So if the concept is similar, you need to apply it without getting confused in it. So I practiced 20 questions of biostrat daily, and then I review it first because it took me time. It takes time for me, like 2 to 3 hours just in reviewing 20 questions of biostrat, or sometimes more, because initially I was just getting 50% in doing biostrat questions. And then it gradually improved after few days to 60%, 70%, and 75%. Then I got confident, okay, now it is going better. And then I did biostrat review, as I told you, biostrat review in U-word, that is similar to step 1, 75 questions. You can just practice the questions, and then if you are weak in any topic or you are making it wrong, like in attributable risk, I wrong it always. So I read that thoroughly from biostrat review. And for example, mortality ratio, crude death rate, everything is explained. If you do not know about it, then it's good to read those questions explanation. Otherwise, you can just solve and practice the questions, and you will know that, okay, this concept is weak, I need to work on it. And then later on, I practiced few questions from step 2 U-word, and thanks to my friend who gave me the ID, but you can do it offline as well. But still, my expectations were not the same as in real exam, because real exam biostrat says, I don't know, it's difficult. Keep in mind.
What topics do you do? What topics you practice from the step 2 U-word?
Just biostrat.
Okay, thanks.
I think there are 150 questions from biostrat in step 2.
Okay. I have a question here.
Sure.
So for the first paper, most common is to study this first aid, immune and receptors, whatever you have mentioned. And for the biostats, go for the step 2 biostats. That's what you are meaning.
Step 1, step 2, step 3, practice questions for biostrat. I'm not saying biostrat for step 2. I'm saying practice and make your biostrat strong.
So why, can you explain, like, why does it feel very difficult for everyone to go through the first day of, like, is it because the question style or because it is of step 1 content?
It is, I feel like it is not because of step 1 content.
Mm-hmm.
The reason is you are already done with step 1. And you have, you know about, for example, if I talk about verapamil, you know verapamil is calcium channel blocker. You know that it causes constipation. You know it can increase QT interval. You know these basic things.
Yeah.
But where problem came is, I was not expecting that my question 1 is starting from here and it is not ending right here. I need to scroll down and read the question.
Okay. Okay.
And while reading such a long statement, you get confused.
Yes.
And firstly, it scare you such a long question. Second thing is you get confused. Third thing is constantly questions are lengthy. It is
Yeah.
not like in step one they tell us that they're a mix and match. Some questions are short and some are long. But for me, in my experience, paper one questions are way lengthy.
Yeah.
You will do assessment, especially one. One has some few small questions. In assessment two, questions are lengthy. Keep
Mhm.
that in mind. Paper one questions are very lengthy. And
Okay.
then you are done with the block, and you have, when you see questions, now you have two drug guide questions, two abstract questions, and you are also getting panicked if you have not solved any Biostat questions. So you
Mhm.
are still left with 6-7 questions, and you have now, for me it was like 10 minutes, and I had 6-7 questions from Biostat.
Okay.
And in my one block, there are three drug guide questions in which you have to open the drug and read it and find and answer three questions down it below it. So if you are prepared for it, your bias rate is strong. You are not getting panicked by such a lengthy questions, because while doing U-word questions are shorter. And my journal pharma is strong. My receptors are strong. So, and my pharma is overall strong. So I was not worried about pharma, but I was worried a lot about biostats. So if your pharma is weak, make it strong.
Yeah.
If your autonomic system drugs are weak, work on that. For
You
me,
have mentioned here the first aid, so we should go for the first aid step 1 or first aid step 2. Which first aid we should
One.
refer? One.
First one, but you can do in last week. It's easy to do it, because in last week, how I did it, I was doing 1 hour or 2 hour daily in last week, and not more than 2 hours. Why 2 hours? Because content was selective. For example, in Biostrat, I have to review lysosomal storage diseases, glycogen storage diseases, lipid diseases, and scared ADA deficiency. Main section of diseases where there is more main section. Then I move to immuno. I just have to see hypersensitivity reactions, transfusion disorders, and transplant disorders, and immunodeficiency syndromes where there is Bruton's what is that? You need to know those diseases on the fingertips. This immunodeficiency syndromes in which they have two pages of first aid. There is no doubt that you will see 2 to 3 questions from those 2 pages. Be prepared for their pathogenesis, for their like in telangiectasia, it is ATX gene problem. So you need to know why this is happening, mechanism, pathogenesis, what is the treatment, and what is the clinical features. Grab those things on your fingertips. And then journal pharma, as I told you about receptors, and mainly there are receptors, but you can go through the main in which drug sections. All drugs you need to revise. If your pharma is weak, then you need to revise, especially neurodrugs, antimicrobials, antifungals, antibiotics, mechanism of action. They will give you a whole scenario, lengthy scenario. You need to know what is happening and what drug I need to give, and what will be the mechanism of action of that drug, because question will be on mechanism of action.
Thank
And why I was not scared about that, because for me, how I did it is, for example, if you ask me what drug we give for cellulitis, then I will think which type of organism causes cellulitis. Either it is gram positive or gram negative. So in most of the cases, it is gram-positive. Then I will only short my list to gram-positive drugs. And mostly cellulitis or abscess, this is caused by MRSA. So which drugs are acting on MRSA? Vanco, linezolid, daptomycin. Then these three mechanism of actions I need to choose. Okay, which one is on these mechanisms? Similarly, if it is UTI, there is a list of there are 3-4 tables in UWord where you revise antibiotics for UTI, antibiotics for GI infections. Because in GI infections, I memorized it like most of the GI infections we give peptides. What is the mechanism of peptides? They will ask you the third step. You need to diagnose, you need to choose the drug, remember what is the drug we are giving, then you can be able to choose what is the mechanism of action. And if few of you are practicing CCS cases or close to exam, or you are in practicing phase, then I have added few mnemonics, how I practiced it. Thanks to one of my friends, she told me these mnemonics that when patient is in clinic, you write blood, these BUIOP. You can take a picture of this, or you can see it in the video, that how you can order these things, so you will not be able to miss anything. In every young lady, don't forget to do pregnancy test. Don't forget to do urine test, urine analysis. So these are best. If the patient is young patient, confused, don't forget to do urine toxicology test. When you will practice it, you will know that these will detect marks. While practicing cases in UWord, they will not give you any scoring. There is no scoring system, but in ccscases.com, it will show you in red color that you have missed this thing. And even if you have ordered a invasive test, it will detect your marks. So do not order invasive tests. And in emergency cases, if you are completely blank out how to manage it, then you can apply this mnemonic. If the patient is in, don't forget to check saturation first, give oxygen first, and you have done everything, and then you see saturation is very low. For example, if you have done saturation first and saturation is 83, 85, 90, you will need to know that it is pulmonary embolism. It can be your 3-4 differential will come in your mind. If the patient is having fever, pneumonia is worsening, and how you will manage it now. This is for surgery patient, because in every case, for example, patient came with abdominal pain. You have done everything. You have done blood tests, you have done CT scan, ultrasound. Now ultrasound showed you that it is an abscess. You have aspirated the abscess, but now you want to send the person to surgery. You will say consult to surgery, and now you will get the other answer. Okay, prepare for surgery. We will shift the patient. Now you have to prepare for surgery. How you will prepare for surgery? You will do these things. You will NPO, take consent, sulfazole and ECG, PT, PGT, and if blood is required, you need to write it. At that point, this is important. And then when the case is almost done, and there is last 2 minutes in which you can add things or omit things, this is a mnemonic for it, and you cannot miss anything that is important at that point. Definitely, you need to reassure the patient. You need to tell, omit alcohol, tobacco, educate, diet. This is written simple diet, but if you write diet, there is a lot of list in which you have to choose. So while doing scenario, while doing the case, focus. If the patient is diabetic, you need to write here low calorie diet. If the patient is overweight, for example, or diabetic, low calorie diet. If the patient is hypertensive, low salt. Then it will make sense. Otherwise, if you write diet, you will get a list, and then it will take your time to choose from the list. and you will learn this thing by practicing. Seatbelt, especially in young teenagers in which head trauma is common. If you miss it in adult patients, it's okay. And exercise if the patient is overweight. If the patient has some infection, STIs, or ectopic pregnancy or molar pregnancy, yeah, safe sex, you need to filter out where you're required to do safe sex and where you are not required. So you can filter out the things. And immunization, you will learn with practicing that we give varicella when the patient is above 50, DTaP, and when we give pap smear, you need to apply that thing according to the age of the patient. Let's go towards question answers. Ask any questions if you have any confusion.
Yeah, I have a question, like as a beginner, where should we start our preparation for? Like what does a day of step 3 prep should look like, and when to incorporate CCS cases?
Start doing start your word, and you can forget about CCS cases in initial prep because these cases are not difficult, and you can already, because when I started, I started doing it in the beginning, but I was doing it like 1 case a day, 2 case a day, and it was a waste of time. Even I was not learning what is happening in CCS cases. Why? Because it was like, I'm taking a break, let's do a case. For me, it was not working. But after taking assessment 1, I got panicked, and then I focused more on CCS cases. How I did it, I grabbed a study partner. I found a study partner, and then I started working with her for 2 hours, 4 to 6. And in 2 hours, we can easily do 10 to 12 CCS cases in one sitting. And definitely you will not talk about random things. It will be waste of time. It was just, hello, how are you? And then let's start doing. Without any talk, we do 12, 10, minimum 10 or maximum 12 CCS cases till 6. And that helps. You practiced because you are sitting, and then after each case, you can discuss with each other, okay, this is the step that I missed, or I messed up this case. How should I approach it? Within 2-3 minutes, and then you can go to the next case. One thing I want to mention here is I felt in step 3, there is a very important factor of study partners. It is important as well as it is difficult. Why it is difficult? Because everyone is doing jobs. Some of them are doing residency, some of them are preparing for match, ERAs, observerships, rotations, research, publications. So everyone is committed here and there. For example, if you are not doing job, you will say, I need a study partner in the morning time. But if the person who is doing job, he says, I can do around 5 or 6, because my study partner gets free at my 4 and I get free around 7. So she waits for me for 2-3 hours. But if I came around 7, then there is no chance for me to ask for break. Then I sit around 7 and I have to sit with her till 12 or sometimes at 1. Then you will not take break. So be wise while choosing a study partner. It helps you because you are discussing things, you can memorize things, and you can revise some stuff or tables from step 2. Because I had made notes in step 2. So if I am unable to grab any concept in from UWord, because in UWord, if you read it thoroughly, you will know one question has 4-5 concepts and there is just one question. In contrast to step 1 and step 2, where one topic has, when one concept has 4-5 similar questions. In step 3, it is not like that. That's why number of questions are almost half. It is 1800 questions. But one question grabs a lot of concepts. Don't overlook explanations of few words. And it's never too late to, if you're weak at anything, focus on that thing. When I took my assessment 1, while doing assessment 1, I know what is my weakness. I know where I am doing things wrong. I know I need to change the strategy now. From very next day, I left my study partner and I started utilizing my own brain 100% to start doing questions. And I focused on weak areas. I realized that I have read this table 100 times, but still I'm unable to apply this concept. And then I remember it was indications of parathyroidectomy. And then I made a mnemonic for it. Focus was its mnemonic, and I applied it. And then I write it 2 to 3 times so that I will not mess up this question again. If you are weak at anything, maybe your study partner is not weak at on the same thing. Take your time and make that thing strong. Or it all depends on you, how you choose your study partner, what is your preference. Either you just want to do practice. Sorry, I lost my words. And similarly for first aid, I will suggest to do it alone. There is a reason. For example, in first aid, your journal pharma is weak. For example, your anti-seizure drugs are weak. For example, you need more time on immuno and you are weak, you are strong in pharma. Then you do not need to give a lot of time on pharma. You have to give time on immuno. So you will prioritize things according to your own weakness. That's what I did. And I hope it helps. How many NBMEs and assessments are there and which one is more predictive for you? There are 2 NBMEs, NBME 4 and NBME 5. And UWSAs are 2, 1 and 2. For me, neither of them is predictive. Why I did first I did UWSA 1. If you are an average student like me, try to pass it. To be honest, try to pass it. If you passed it, now filter out your weak areas, focused on your weak areas, try to make it strong, try to improve your time management, because time management is very critical for step 3, especially for paper 1. And then I need to take one other assessment to build up my confidence. At that time, I did NBME 5. One thing, I need to practice more questions. Second thing, I need to build my confidence that I can take the exam. Because for me, there was very narrow timeline. My next new job was going to start and I was just requesting them to give me a few more days. So I cannot push my exam. That's why, and then I took NBME 5. And after that, I was a bit satisfied that I can pass it. Then I focused more on weak areas and did assessment 2. That improved my score. And for me, to be honest, real exam scores are 20 points more than my first assessment and 10 points more than my second assessment. So it all depends on you. Definitely, I will not go for exam if I failed my assessments. If you are passing it, then try to improve your scores on the next assessment. And if you are improving it, then trust yourself, trust whoever you believe in, and then go for exam. As if you want it before September, I will say you can do it, but you have to devote your time. And if you want to do it after match, then stay calm. You can still do it. It's easier than step 1 and step 2 because you will not burn out during preparation. Yes, that is difficult because of jobs and because most of IMGs in step 1, step 2, we do not do jobs while preparing for exams. But in step 3, we are doing rotations and jobs. So you need to manage 2-3 things together. How many hours are enough if we just took step 2? If you are starting now, try to do 40 questions a day. And what I meant by 40 questions is, for 40 questions, if you are seeing a concept of tinea capitis, go back to your step 2 notes, revise the management of tinea capitis right away. If you're saying a question of actinic keratosis now, it is just saying and telling you one treatment, you need to revise it, the other 3 treatments from your step 2 notes. Or if you need to recall that, either you can recall it with your study partner, you cannot just move to your next step.
We have
Does
a
the
question. I'm
does the
sorry.
step 3 scores matter as the step 2 and step 2 scores matter? Do the step 3 scores matter?
Dr. Kumar, I think Dr. Kumar has also a question. Go ahead.
Sure. Dr. Kumar wants to give recap and feedback of his step 3 exam. Sure, you can do that. But give me a second. I want to answer this last question. And people told me that it does not matter. But still, I would prefer to get an average score. That
Thank you.
looks good. It's your own satisfaction. My aim was to get average scores.
Thank you.
Go ahead, Dr. Kumar.
Thank you. First of all, it's now good afternoon over here as well. And it was really a nice webinar. She covered all of the, like all big as well as small areas which we neglect. So I think she gave a very, very detailed, like how you should prepare for your step 3 exams. And she's right. That's what I did with my exam. The thing is, my biostat was very strong. So what I did from the day one, I just did my all biostat question once, and then I revised at the end. So my biostat was strong. But my weak areas were pharma. So I started working on pharma in the beginning. So like when I was done with my biostat, so I started working on my pharma. And the next thing regarding CCS, people have a lot of confusion regarding CCS, and she's right. You should do it slowly. The reason is the software or the website has a set endpoint. Once you reach the endpoint, the case will direct you to end. Like it will leave you with the 2 minutes where you have to give general advices. So be slow in that. The example is if the case is tension pneumothorax and you just type needle thoracostomy, not doing any examination, nothing, the case will directly, it will end. That's why you need to be slow. Try not to put the endpoint once the patient is not stabilized. You will get to know about that when you will start practicing. And the right time to start practicing is like if you do it on a daily basis, like our weekends, like once you're done with the UL Monday to Friday, and on weekend you should do practice it. That's also right. Like not starting at the end. That's also good. It all up depends how you want to cover your all areas. Okay, what I was doing is like I did UL. Once I'm done with my block, I used to do 3 to 4 CCS cases every day so that I should have a good grip on them. And I realized the test has an endpoint. Once I reach that, the case ends and I get less marks. But once I go slowly, try to understand what is the need, then it's like I was getting a good percentage, I will say, in ccscases.com. That's the main thing. Regarding paper 1 and paper 1 is usually basic and biostats. Basic means the immunobasic, the micro, they don't ask what organism it is, but they ask the property of the organism. They don't ask what drug you will give. They usually ask what is the mechanism of action of the drug. They don't ask what is the disease. They usually ask what is the risk factor for the disease. So she covered it very well. And regarding paper 2, usually it comes from step 2 type material. So you should remember the all charts you used to study in step 2 CK and CCS. Definitely you should give a dedicated time. Around 25% of your marks weightage is on CCS cases. That's what I want to say. Thank you, Dr. It was really nice
Thank you
and
so much.
detailed
Thank
webinar
you
for
so
them.
much, Dr. Kumar. I just want to add one thing. Please, please, please practice 6 CCS cases from NBME orientation website to get familiarized with the real exam software. Real exam software is different, and case will automatically end. Your patient is not stabilized, patient goes home, and you will not be able to control it if you will not understand the software. Yes, practice it from ccscases.com website, but to familiarize with the software for the real exam, do 6 cases from NBME orientation website.
Definitely. I agree on that. Definitely.
Because trick while doing CCS cases is that software. You have to move slowly. You cannot just write your mnemonics and going on, case will end, and it will not even tell you that what was happening with the patient, what is the update. You need to do it slow.
And forget not to mention that there will be a lag time as well for a few seconds, so don't get confused. Try to practice with that time,
Yeah.
the lag.
This is also a thing that they will show you in NBME orientation website. They show you that there is a lag. When you click, there is a screen is loading for a second or two. When you will practice it from the website, real exam is exactly similar to it.
Okay. Thank you so much, Dr. Bushra. Thank you so much, Dr. Kumar, for sharing your experiences. And thank you so much, everyone, for attending the session. It was very interactive, and I believe everyone, including me, acquired a lot with this session.